Have you been struggling with pesky shoulder blade knots? You know which ones I'm talking about. The ones that you feel back in here, it can radiate behind the shoulder blade. Sometimes if you feel like you hit the spot, it spreads out, maybe even radiates up into your neck sometimes. Well, most people will see tons and tons of different providers and they'll get all kinds of different opinions. Some will say, oh, you have a rhomboid strain, or you must have pulled a muscle back there, or your rib is out. They'll come up with all these different things. But most likely what's going on is it's something called a Cloward sign. So what that means is there is a spot within one of the discs in the neck and it can refer pain right underneath that shoulder blade. So you'll do everything you can to get to it, but you can't just quite get there. So we're going to talk a little bit more about the Cloward sign, what this pain referral pattern means, and then some of the different things that we do to help patients get rid of it once and for all. All right, so what we're going to talk about here is the Cloward sign and exactly what this looks like. All right, so a Cloward sign is a referral from C4, C5, C6 at the level of the disc. All right, so the way this works is these dots are likely where the discs are located, so the pain is actually generated from this region. And what will happen is where you'll feel the symptom is further down into the shoulder blade. So what most people don't understand is the cause of the problem is way up here, the actual symptom is down here. The problem is most people spend time trying to treat the symptoms. So they'll lacrosse ball this area, they will try to do different exercises to train this area, they'll think you have a rhomboid strain, all these different things, when really the cause of the problem and the anatomy behind it is up in here. So if you're not doing anything to treat the lower neck, bottom line is this will not get better. And adjustments don't fix this type of problem. So we'll talk a little bit more about solutions for this problem and some of the things that we do to help fix this issue. So if this is a problem you've been struggling with, you're probably wondering, what do you do to fix it? I've already tried a whole bunch of different things. So usually the full recipe is a combination of some dry needling locally to some of those segments. We'll do some different hands-on techniques to loosen up some of the tissue. Then we'll do some light traction, which is just a pulling apart of the spine just very gently at those local tissues. And then we'll also do some strengthening of the upper back muscles, but we have to do this very strategically so that we don't overload the tissue and then create more nerve root irritation or disc irritation. One of the exercises that we usually have patients start with is a very simple cervical retraction exercise. This can either be done in sitting or laying flat on your back. We'll demonstrate the sitting or standing version right now. So all you're going to do is you're going to pretend like there's this slobbery St. Bernard and he's trying to lick your face. And your goal is to get away from him, okay? So you'll have your head in this nice, tall, lengthened position, and then you're going to bring your head straight back. It's not a flattering movement, but what it's going to do is it's going to target those lower segments of the cervical spine, and you may even feel it radiate into that shoulder blade a little bit. If you do a few more and that pain gets better, then continue to do it. It's actually helping the symptom. If you're doing it and the pain gets worse, then you need to lay it flat on your back and then try this movement. I usually recommend people start out with like 3 sets of 5 and then build up to 3 sets of 10 if this feels good and it's alleviating your symptoms. If you found this exercise or any of these tips helpful in finding a diagnosis for a problem that you have, or as this is part of a solution for you, feel free to drop it in the comments below. We'd love to hear from you and get your support. We'd also love it if you could subscribe to our channel. If you have any questions, also put them in the comments below. We're happy to respond as best we can. Thank you for supporting us, and see you soon.